So our movie we chose is Finding Dory. Finding Dory takes place throughout the ocean in California's prestigious Marine Life Institute. Dory, the main character, is a blue-tang fish set out to find her parents, even though she has no memory of who they are or where they used to live. When Dory was just a little fish, her parents tried to instill in her brain the introductory of, "Hi, I'm Dory. I suffer from short-term memory loss." This tells us that Dory suffers from anterograde amnesia and that her condition is hereditary, meaning she was born with it. Dory's absence of long-term memory makes her journey long and difficult, but she is determined and always reminds herself to just keep swimming. Dory, the regal blue-tang fish, suffers from anterograde amnesia. Anterograde amnesia is short-term memory loss, and it is a disorder that hinders the ability to remember new information while still remembering information and events that occurred prior to the injury. Another common characteristic that occurs with anterograde amnesia diagnosis is that although the victim can no longer create new episodic or semantic memories, they still have the ability to create new procedural memories.
Dory has a 10-second memory span. Once every 10 seconds, she loses her train of thought and forgets what she is doing. Another one of her symptoms is her reliance on external cues to aid her memory. This is shown in her use of shells left by her parents as a visual guide to find her way home. One of the symptoms that Dory does not show is the inability to speak well. Dory has a very distinct voice and talks very loud and fluently with others. She can hold a conversation well as long as she does not forget what she is talking about. In this scene, we see Dory in the middle of her conversation with Hank, and she feels the tag on her fin while she's talking to him and freaks out, even though she's seen it so many times before and realized it was already there.
So what a truck. Then you can go back inside and find your family. All you have to do is give me the
tag. Oh, there's a tag on my fin.
How could you forget you have a tag on your fin?
Oh no, I'm sorry. I suffer from short-term memory loss.
Dory searches for her parents in this movie because that is one of the only long-term memories she has. She often forgets small things like where she is going and Nemo's name because those are short-term memories that she can't retain. Her inability to keep memories makes it difficult for her to complete short and long-term tasks. Dory's parents try to teach her common everyday skills while she is little, but she cannot stay focused long enough to understand. In the video attached, Dory's parents attempt to teach her how to play hide and seek, but Dory forgets what she is doing and swims off with the other fish. This symbolizes Dory's struggle to fit in with her peers and is further substantiated in later scenes.
To be your friend, okay?
Okay, Daddy.
Now
I'm hiding.
Now count to 10.
1, 2, 3, 4. I like 10. 10 is squishy.
Dory?
Someone with anterograde amnesia, it is important to remember that there is no proven cure. Even though there is no cure, treatments can still be implemented to manage the condition and potentially improve the recovery process. If I were to propose a treatment plan for Dory's anterograde amnesia, I would start by encouraging Dory to utilize rehearsal, conscious repetition, whenever possible, so that over time her brain learns that repetition of events means importance. I would also implement procedural learning sessions with the therapist so that Dory can learn through cognitive and motor skills since her implicit memory should still be intact. The last form of treatment I would recommend Dory try would be cognitive behavioral therapy, as it can identify what situations/triggers worsen the anterograde amnesia. One ethical concern could arise with this treatment plan would be whether or not someone with no long-term memory can consent to the scheduled therapy sessions when they might not have the capacity to make such commitments. A few barriers Dory might experience with this treatment plan include her geographic location. This could be a barrier to treatment as therapists might not exist in the Ocean or Marine Life Institute. This would make procedural learning sessions and cognitive behavioral therapy no longer options for treatment. Another barrier might include privacy concerns since Dory only has a 10-second memory. The last barrier I think Dory might experience would be fear of treatment, since someone would need to explain to her what is going on every 10 seconds to prevent her from freaking out during therapy sessions.
The film Finding Dory shows Dory frequently forgetting recent events, names, and directions, which is consistent with the primary symptoms of the disorder. However, the film exaggerates the severity and frequency of her memory loss while simultaneously simplifying the complexity of managing a life with anterograde amnesia for the sake of entertainment. Mental disorders, including amnesia, carry several stigmas, including a perception of incompetence, an overemphasis on disability, and a lack of empathy. The portrayal of this disorder in Finding Dory is unique in that it familiarizes a younger audience with anterograde amnesia. Although the film does portray aspects of anterograde amnesia accurately, it does so with exaggeration and should be considered with a grain of salt. Anterograde amnesia can be diagnosed in all cultures, much like other medical conditions. However, the treatment of this disorder can vary greatly depending on the culture's beliefs and healthcare infrastructure. Some cultures might also attribute the symptoms of this disorder to spiritual or other causes instead of seeking treatment options. If Dory went to a therapist in the film, she would be diagnosed with anterograde amnesia. This is likely to be the diagnosis across most cultures, as anterograde amnesia has clear and identifiable symptoms. However, while the diagnosis would likely remain the same across cultures, the approach to the treatment and support can vary significantly. And these are our references. Thank you.